In part one of this video, we're going to have a look at blood vessel structure and function. So let's start by defining the different types of blood vessels. So first of all, what is a blood vessel? Well, we know what it is. It's things like arteries, capillaries, and veins. And of course, they're used to circulate fluid, aka blood in this case. Now, let's start with arteries. So the definition of an artery is a vessel that carries blood, and this is important, away from the heart. Now, typically, we think of it as being oxygenated, but remember when we looked at the heart, the artery ran from the heart to the lungs because it was running away from it, but was carrying deoxygenated. So that's a key thing. Arteries carry blood away from the heart. Next thing, we have capillaries, and we'll have a look at 3 different types of capillaries in the next video. But these are in direct contact with the tissue cells. And this is really what keeps the tissues alive and well through exchange of products like water, nutrients, and wastes. And then the third core category are the veins, and they carry blood towards the heart, to the heart. Now, in general, we think of it as being deoxygenated, but let's not forget that once again, when we're talking pulmonary circulation, that is the opposite there. So let's start and look at sort of the typical route we're all familiar with is that from the heart, we start tracking it. We're into the arterial system. We are going to go into arteries. Now, not every artery is the same. The ones near the heart, we ask different things from them versus the ones that are further away. So we're going to have different categories. And one of the categories we're going to look at are elastic arteries. And often we call these a pressure reservoir. And then we're going to have muscular arteries. Why? Well, because they have more muscle in the mid part of the wall. And often they're known as distributing arteries. These are the arteries that are going to decide or distribute blood to different parts of the body depending on the needs. And then typically we're used to seeing this is that we get down into towards the capillaries. Now, before we get to capillaries, we get into the arterioles, and often they're called resistance vessels because they can change their diameter and change the amount of resistance that the blood is going to experience. And then we go into a terminal arteriole before we head into capillaries. As I said, we'll talk about capillaries in greater detail in the next video. Then, of course, blood is collected through venules into small veins, often called capacitants, because most of the blood actually sits in the venous system. But that discussion is for another video. The blood gets collected and then returned to the heart. Now, I want to point out that we do see another structure right here, and that would be the lymphatic system. Just a little side note that when we lose fluids here in a capillary system and it moves into the tissue, most of it is recovered back into the capillary system. About 85% of fluid does get recovered within that capillary bed, but that means that there is 15% which is not recovered, and if it was to stay there, I would have localized edema. And that is the role of the lymphatics. One of the roles is to take up the excess fluid, pass it through lymph nodes for quality assurance and control, and make sure there's no infectious agents, and eventually return it to the venous system right near the heart. So that blood does, or that water from the blood does get recaptured. So let's start looking at a blood vessel. So all blood vessels have a lumen. That's that central area that the blood travels through, and it's surrounded by a wall. Walls of all vessels, except for the capillaries, have 3 layers. Now, the fancy pants name for layers is tunic. So we're going to see it's called tunica interna, the internal layer, tunica media, the middle layer, and tunica externa, the outer layer. Now, capillaries are different because we want them to be thin so we can do exchange between the blood and the tissue and the tissue and the blood. So what we're looking at is basically an endothelium with a very sparse basal lamina as a part of the structure and function of them. Let's start looking at the 3 layers of the blood vessel wall. Tunica interna, also known as intima, okay? This we often refer to, why does it get the name? Because it's in contact with the blood, it's intimate with the blood. We have an endothelium. Now, this is a simple squamous epithelium, which makes sense when you think about where it is. And this lines the lumen of all the vessels. And this is actually continuous with the endocardium that we saw in the heart. And think of this as almost being like a Teflon. It keeps things from sticking to it. It reduces friction. Now, deep to the endothelium, I have a subendothelial layer. And this is a connective tissue basement membrane, but found only in vessels larger than 1 millimeter. So the really, really small ones don't have this. Let's go to tunica media. This is a middle layer composed mostly of smooth muscle, plus there are sheets of elastin. Because remember, when we're in the arterial system, we will have pulsate flow, fluctuations in pressure, especially when we're near the heart. And we need that flexibility in blood vessels, all the blood vessels. We also have sympathetic vasomotor nerve fibers that innervate this layer, right? Because it's a smooth muscle layer. So the sympathetic vasomotor nerve fibers innervate it. And of course, what this does is help us with what we'll generally call vasomotion, which is both vasoconstriction and vasodilation. And we know the diameter of a blood vessel has a huge role on the amount of resistance that that vessel is going to have for blood flowing through it. And a very small change in constriction or dilation of that blood vessel will have a big influence on how blood can flow through it. And this is one of the biggest layers, and it has a really big job in maintaining blood flow and blood pressure. Let's go to the externa. With a name like this, not surprising, it's the outermost wall, also called the tunica inventiva. So these two names are synonymous with each other. Mainly composed of loose collagen fibers. What are they doing there? They're protecting and reinforcing the wall and anchoring it to the local tissue and structures. It also has a number of nerve fibers that run through it and is associated with lymphatic vessels. And by the way, the large veins also contain elastic fibers because they tend to have more blood in them and have the ability to distend, but you want to keep that sort of controlled, so elastic fibers help with that. And then we have this feature. Let me highlight it. It's called the vasa vasorum. And this is really interesting because especially if you're a large blood vessel, you may need your own small blood vessels to help maintain you. So this is a system of tiny blood vessels found in larger vessels. And what's their job? It's to function and nourish the outermost internal or external layer, I should say. So let's have a look. We can see an artery and we can see a vein. Now, both arteries and veins have the tunica interna or intermedia, the media layer, and the external layer. So all arteries, veins have those. The difference is in the details. How thick is this layer? How much smooth muscle is there? And this can even vary within a group of arteries. If you're closer to the heart, where there's higher pressures, we're going to need to slightly alter your structure, but we'll still have all three layers. And if you're a vein, depends if you're big or small, you'll have the three layers, but we may have to subtly alter how much of each one of these layers and some little details that are associated with it. Now here we can see, we talked about the vasa vasorum, so we do have these really small blood vessels that help to nourish the outer layers of the large blood vessels. And when we're looking at arteries, there's three sort of main types. There's the elastic, there's the muscular, and there is the arterial. And each one of them is designed for what we expect of it. Elastic tend to be near the heart where there's big fluctuations in pressure, allows it to expand and contract. And this helps to mitigate some of those pressure fluctuations. and also keeps the vessel from being destroyed by those high, low pressure cycles that are coming through it. And you can see that, looking at the chart here, we can really see that it changes as to what type of tissue is in here. Let's go to muscular, also known as distributing. Not surprising you get their name, because look at this. Large amount of smooth muscle. So these, certainly can do vasodilation, vasoconstriction, which can help direct blood to certain parts of the body where I may need more blood. And then we get down to the arterioles. These are the smallest ones. You can see that they do have some smooth muscle on the outside there. And of course, they're small, but they still have, relatively large amounts of smooth muscle within them. It's a lower pressure within here, so I don't really need as much elastic tissue. So we see similar layers as we work our way through different types of arteries, but we modify them based on the needs. The form and the function go hand in hand. And this is a great little summary that you can spend some time on, just so you can really get a sense as to that. Okay, same thing with veins. We would go from capillaries to venules to full-fledged veins. And you can see, one thing you see is you don't see a whole lot of elastic tissue. And of course, the reason is that these tend to be a very low pressure type of vessel. Because once you get through the capillaries, the blood pressure is quite low, and we don't see the systolic, diastolic, and overall the pressure is low as a result. But I do have things like smooth muscle, because once again, this allows us to direct blood from going from one area to the next by changing the diameter of a blood vessel, which changes the resistance of that blood vessel. All right, so when we look at arteries, we have three types: elastic, muscular, and arterioles. And let's just have a quick look. Elastic, thick-walled, large, low-resistant lumen. Examples: the aorta, all the major arteries, especially up near the heart, right? All its branches coming out from here. Sometimes called conducting, because they're going to send blood from the heart to the sort of medium-sized vessels. Elastin is found in all three layers, especially the tunica media, because here near the heart, you're going to have high and low pressure fluctuations all the time, and this allows it to expand and contract. It also does have a fair amount of smooth muscle, but it's not really used for vasoconstriction here. We're too close to the heart to really want to vasoconstrict stuff too much. Because if we vasoconstricted, say, the aorta, that would mean that I would have a high afterload for the left ventricle. And if you're not sure what high afterload is, just go back and look at the chapter in the heart and our discussions about preload, afterload, and factors like that. So acts as pressure reservoirs that expand and recoil as blood's ejected from the heart. Yeah, it's a bit of a sponge. It's a bit of an elastic sponge, if you want to think about it. And what it's doing is soaking up some of the pressure from the high and the low, and try and mitigate those extremes as blood moves into the smaller arteries, and allows for continuous blood flow downstream, even between heartbeats. Because think about it, if you're right in the aorta near the heart, blood comes rushing in when the ventricles contract. And then when the ventricles go into diastole, blood's going to stop. So there's a real pulsate movement of blood into the arterial system near the heart. But what this does is, by having that elastic, it sort of expands with that pulsate flow. As that blood floods into the aorta, it expands out. And then it slowly slowly in terms of the biological world, will contract. The elastic fibers will bring it back to its original position. And in many ways, that takes what is like a big ball of blood and rolls it out. It smooths it out and extends it. And that's going to decrease the high and low pressure pulsation of that blood further downstream. So very important. And as people get older, these become less elastic, which means that these vessels, and especially vessels downstream that were not designed for the high and low pressure, start to suffer as a result. Muscular arteries Elastic arteries then give rise to the muscular arteries, and that's a bit of a clue right there, the name. Also called distributing because they deliver blood to body organs, right? How big are they? About, pinky diameter size to kind of, the lead, the graphite in the middle of a pencil. So we're not talking huge, we're talking those mid-range ones. And these are the most common, right? Most of the artery names you'll learn are, almost all of them, are these type of muscular arteries. Now, they have the thickest tunica media with a lot of smooth muscle, but less elastic tissue. And you're wondering why less elastic tissue? Well, hopefully by the time blood's gotten here, the first group of arteries have absorbed some of the pressure. So these ones hopefully aren't experiencing the really high and low pressure that we see. And we have a tunica media that's sandwiched between these two elastic membranes. Now, this one really does have a role in vasoconstriction, so vasomotion. And not surprisingly, that's one of the reasons it has all this muscle within the middle to allow it to vasodilate and vasoconstrict. Arterioles, smallest are of the arteries. Now, the larger arterioles have all three tunics. Smaller ones are mostly a single layer of smooth muscle that's sort of surrounding the endothelial cells that are inside. These control flow into capillary beds via vasodilation, vasoconstriction of the smooth muscle, and also called resistance arteries because they can change their diameter. And remember that basic concept that when you change diameter of a blood vessel, you change the resistance, and that has an effect on blood flow through there. Now, these are the ones that are going to lead off to the capillary beds. Now, when we're looking at capillary beds, there are different types of capillaries. And what we're going to do is we're going to stop here, and then I want to come back, and the follow-up video after this will be looking at capillaries and the different types of capillaries. Okay, we'll see you in the next video.